Well, I want to thank everybody who's taken the time to join us this evening. We have two extremely dynamic speakers with us this evening, so it's going to be exciting. And my name is Sarah, and I just always help Dr. Zuckerman with his webinars and just kind of moderate and make sure everything runs as smoothly as possible, as best we can with technology and such. But I just want to go over a couple of things before I introduce Dr. Zuckerman so everyone has an idea of what to expect this evening. So as you know, this is practice success with class 4 lasers. And so Dr. Zuckerman is going to be doing a demo of the REMI class 4 laser. If you've taken a minute to check out the REMI on his website, remilaser.com, maybe you've seen some of the laser chats. But one of the things that is going to be new this evening that he has not presented yet is a new surgical handpiece. So the hand pieces for the REMI laser are already very innovative and very intuitive for patient use. And so having a new one in play is very exciting. And when Dr. Zuckerman is done with his product demo, we're going to split the lectures up just briefly with some Q&A for the demo portion of the presentation. So if you notice on your GoToWebinar navigation tools, there is a space for questions. And if you type a question into that box, I will be able to field those questions. I'll pass them on to Dr. Zuckerman once he's done with his demonstration, and we'll get your questions answered. If for some reason a question of yours doesn't get answered, we do have a record of those on file once the webinar is over, so we'll be able to reach out to you and get your questions answered after the fact. After the first demonstration and Q&A, we're going to turn it over to Dr. Chris Milkey, who is a cash practice expert and is also a podiatrist. So he's going to sit with you and really go over the key success factors of making class 4 lasers successful with marketing strategies and how you can not rely so much on insurance because, as we know, lasers is very much a cash-based service. So, and then Dr. Milkey will also be fielding questions from everybody. So again, if you have a question for Dr. Milkey during his presentation, feel free to jot them down in the questions panel on the screen. I will also see those. I'll field those, send them to Dr. Milkey, and we'll get those answered as well. So I hope that gives everybody a good idea of what to expect tonight. And without further ado then, I will go ahead and introduce Dr. Zuckerman. I have had the pleasure of working with David for the last several years, helping him with some marketing initiatives. And the REMI is just kind of my marketing baby. I'm really excited about the work that David and I have done together for just educating podiatrists about the program, as well as providing some marketing tools for your practice as well once a purchase is made and you decide to implement it. But David has been involved with class 4 therapy since it was birthed. I mean, David has made a name for himself as a podiatric technology pioneer, and that's 100% the truth. He's had his hands on virtually every laser you could imagine in the podiatry space, and so for him to stand behind a laser like he stands behind the REMI really says something, because he knows them all in and out. And so for him to really push this one forward at the top of the market is definitely a valuable statement. So I'm going to let you get to it, David, and I think everyone's excited to see what you've got.
Hey, thank you very much. I appreciate it, Sarah. I just want to say something very quickly before we get into this, to the REMI and go over some of the features of it and some of the newer features, is that you can have the best laser in the world at the fairest price, fair to your patients, good return on investment, but you must know how to market. And that's one of the reasons why Dr. Chris Milkey's here tonight, because it's very important to know how to market effectively and cost effectively in your practice. So I'm looking forward to hearing Chris. I really enjoy when he comes on. And Chris, I appreciate you coming on at this short period of time. But anyway, this is the Remy. It's 4 pounds, very, very light, very portable. It's a 30-watt laser dual wave. I'm going to turn it on. Very easy to use. Turn it on. It's a little noisy with the fan. Put the password in. And now you're there. Now there's two parts to the Remy. There's this they're all the programs are built in. It's got pulsing presets, and then it's got the proposals that I'll talk about in a little bit. They're the ones that I've used personally for many, many years. But you have options. My whole goal is when I train you in a laser, that I teach you how to make pain go away regardless of the proposal. And I'll get a little more into that. It's all about power density. And I train you with principles, effective principles, so that you can help that patient, whether you have and I love this. This is a dual wave laser, but even if you have a laser sitting in your closet, you'll bring it out because I'll show you how to use it. But the Remy is, it is an amazing laser. It's, give you an example, you press the info. This is a dual wave. This is my favorite. The two effective wavelengths are the 980 and the 810, but I can make anything you want. You mentioned the wavelength. I don't recommend going crazy. You want to use something that has stood the test of time and is as the wavelengths that are used throughout the world, and that is the 980 and the 810. Each wavelength is 15 watts, but you can adjust it any combination you want. So you just press it and you're back. And I'm just going to go over one aspect that we're going to the foot. You can pick the body size, you can pick the skin color, and it's amazing with the Remy. It's not the Remy doesn't get real hot. We used the straight 980 and it got hot. The Remy is nice, it's warmth, but it's very difficult to burn the Remy, burn the patient with it. And I explain that in much detail. Tonight I'm just going to a broad view of the Remy. You've got the chronicity versus the pain level. We'll just pick it's a moderate pain, and the pain level is mild or high. We'll put high. You press it, and you're there. It's already set. On this, you have the average power and the peak power. The peak power on this particular program is 12 watts. The average power is 6 watts. The behind the scenes is the 30. This is a 30-watt diode in there, and I'll explain that to you in detail. I can't do everything tonight, but the diode that's in that laser, the peak power helps penetration. Penetration is extremely important with these two wavelengths on the Remy, the 810. The 810 is the one that penetrates the most, but the 980 has the highest analgesic. There's a word that you have to know, and I will go over and over again with you. It's called photobiomodulation. Very important tonight that we're not going to talk about it. And all you do with the Remy is you press this and the beam comes on. It has a finger switch. All the attachments can be run off a finger switch, and we'll get into that in a few minutes. So you go back again. I like the proposals, and in the proposals, I'm going to pick fungus. These are they're all FDA cleared proposals. With the Remy, there's two parts to it. There's the surgical part and there's the therapy part. I believe it's the only laser that I'm aware of that's FDA cleared for pain, fungus toenails, and surgery. When I say surgery, we're talking about where you numb it up and you can cut out a wart, or you can use with no anesthesia and treat warts, mosaic warts, regular warts. It's very effective. The way it works is it's a laser. It's not a hyphicator. It's a laser, so will stimulate the immune system. It has a feature where it will coagulate the capillary beds, and it can also destroy it. It can do all of that depending upon the protocols. And I teach you when to do it, when not to do it. If we go into fungus, you press OK. Now again, the average and peak power, but you can change the time if you wanted to. You can read any journal that you want to and get parameters, and you can put it in the Remy. So it's very versatile and adapts to what's out there. I say stick with the time proven parameters that come with the Remy. You can change the frequency. How are you going to change the frequency? You just press it, tap it in, and you're done. You can press OK and it's in. You can change it. The duty cycle is another way of explaining time on and time off, or the how long it's on and how long it's off. I happen to like all your fungus protocols are pulsed. The pain, I happen to like pain in a continuous mode, and I can explain that at some time. Now we're going to get to what I think is amazing. The Remy has this handpiece. It's a very light handpiece. It actually has a zoom feature where you can change it up and down to whatever feature. I recommend using the settings that I have, but you can move it up and down. You can go from 15 to 20, 25, 30. And the beauty part of this is it locks right in place. It can't move. When I was involved with K-laser for years, it would move, and all of a sudden it would take the beam and go down. Also, this is based on the 1200 K-laser that I introduced many years ago. Very similar, except it was only 12 watts. This is 30. And I've changed the hand. There's a lot of differences, but what's important, you got to be very careful of a handpiece that's on the side because it'll crack the case. The Remy goes right in the back. You keep taking it off and on, and a certain percentage it will crack. Now, let's say you're doing everything is finger switch control. You take the handpiece off just like this, and you just put this on, and now you're doing fungus. Just like that. You're doing fungus. Finger switched, very easy to use. This is 7mm. We do have a backup. If you, let's say you break this, all the features of the Remy have, they have two handpieces with them. Let's say you're for some reason your staff gives it to you and they drop this. Just like in an OR, you drop an instrument, you want to have another one quickly on the tray. You can use the Remy with a 15 on fungus. What I don't want to happen, and I built this laser so that as a podiatrist, I'm in the room and I don't want to cancel patients, or all of a sudden something goes wrong with a handpiece. You just put another handpiece in. Yeah, it was extra expense, but I put another handpiece in and you move on. I don't like canceling or delaying treatments with patients. And then you get another one, but you're not on the phone. What's the matter with this and that? All the Remy has built-in codes that can tell you exactly what's the matter with it. Now here's the new feature on it, which I'm kind of, this is the surgical handpiece. Slip it right on. This is a bare fiber. And I'm going to show you. I happen to love this, the regular bare fiber, but you have to hook the bare fiber up and you got to put a foot pedal. With this one here, this is the same handpiece. This is the same as this. And you can use this multiple times. They come sterile, depends on the procedure. I would never use this multiple times if you're actually numbing it up and cutting it out. But it's real simple. Each one comes in a sterile packet. You just take it out. I'll show you how to put it in. It's very, very simple. Comes out of the packet, you put it in, you slip it on, tighten it up. We're even working on even making it simple. And you're ready. With this, you had to strip it each time. You didn't have to strip it, but I recommend stripping it. And it's a wire. I still will always supply this with it as a backup. I want you to learn how to use them both. But how much more convenient can you get when a patient walks in and you want to, for some reason, they say, I want my nails done. It's just, you can go from one room to the other room. I mean, this is very light. I mean, look at this. It's a very light laser, and I believe it's the only laser that has these multiple handpiece. Surgery, it's off, back to therapy, and you're raring to go. I think I've covered a lot of things. One of the things, if it's not done in the Q&A, I'm very happy to compare the Remy laser to any laser that's out there and show you the differences between the two, the comparisons and the differences. Another thing is that with the Remy, it's been over in the United States for over 2 years and longer in the world, is all services done by my service center, which is I've had for over 10 years. The Remy has a 5-year warranty included for every laser that's sold. 5 years. That shows you the quality. It has very, very little problems with this laser. It also has, we haven't had to upgrade the software for a while, but if we need to upgrade the software, you can download it right off the internet and put a little chip and you're done. So that's all I have to really say about that. I hope I covered everything with it. It's a very simple laser. It's not simple in design. It took a lot of engineering to do this, but there's no, I mean, it's only 4 pounds. It's named after my Yorkshire Terrier. It's portable. My Yorkie is, well, now he looks like he's 1 pound because he got a haircut, but it's only it's less than 4 pounds, this laser. And I like to keep it simple, stupid. Press the button, go. Change the handpiece, go. Have a backup handpiece in case something were to go. All these handpieces, this has the finest micron thickness. This is 600. Most laser handpieces, this is called fiber optic cable, are only 400. I went to 600 because, you know, if you were to run over this, it probably wouldn't break. But I don't want it to break. And if I haven't had these break, I'll be honest with you. I've had a few burn out. We have over 200 of these out there that I can count on my hands how many have burnt out. But I think we have a great design here. It has a great track record, and people are very happy with the Remy. We have everything to make you successful in your practice. And you have me as a mentor. I'm here dedicated to help you and answer all your questions when you need me to do. What I don't like is I've seen some doctors, patients in the chair, and they've never done the procedure before, and they walk in and the patient, I've had this happen in certain parts of the country, where the patient is there and they're ready to do the procedure and the patient's helping the doctor. Trust me, I've had that happen more than a few times. So the more you know about this technology, I'm going to leave you with one word, and then if you have some questions, that's fine. If you want, I'm always willing to do a one-on-one demo with you and discuss it more in depth. But I think I covered it pretty much with you. So that being said, if anybody has any questions at that time, feel free to ask me.
Yep, so we've got a couple of questions that have come through, David.
Sure.
I'll start here at the top. This is from somebody who already has a Remy laser and says, I have had the Remy for about 9 months. How do I
Okay.
get a surgical handpiece?
Okay, with everybody that has it already, it's already included. Just email me, text me, and I'll get you one.
Cool. Easy enough.
Easy.
All right, here is another satisfied customer. I have and I love the Remy. However, I forgot what Dr. Zuckerman likes best for placement of handpiece for fasciitis and Achilles tendonitis. I have moved it and want to use his recommendation.
Okay, well we're going to briefly talk about the WOW experience. And we'll talk about plantar fasciitis. It's real simple to get a result. I anticipate, and I have, and many doctors have, when the patient walks in, there's two parts to the treatment. Part one is get rid of the pain, and you're not going to heal something in one treatment. Physical palpation, let's say it's the plantar fascia, you press on it, and of course it hurts, the plantar medial aspect. The second thing is you treat it, okay? You need to get the right, and the way you treat it is I like circles. You want 60% of the treatment at the plantar medial insertion. Now, how do you know you have the right dosage in that area? I said 60%. What's 60% mean? Well, in the middle of the treatment, 2-3, repalpate it. You are done when you press on this deeply and they have no pain whatsoever. Some people, I set it for 10 minutes. It could be anywhere from 5 to 10 minutes of treatment. But the way you know, and I think this is what's mean, first of all, it's contact. Another thing that's helpful is you want to move the toes. Motion is very important halfway through the treatment, but you want to put pressure. In the end, a minute, press down on that handpiece deeply. This handpiece, because of the cap, can push down on it. I like this, pushing down on it. The way I've given you some concepts, but the way you know you've done it right is there's no pain when you're finished. If they still have some discomfort, it feels better, but keep doing it until the patient has no pain whatsoever. Now, why could I do it in 7 minutes? Because I want you to understand, you got to keep the handpiece. You want to cover the whole area. And I recommend on the bottom of the foot, follow the nerves, the medial and lateral plantar nerves. Follow them, really important. The better the diagnosis, the better the result. But if I hope that's what the person who wrote that is the placement. It's in contact, pressure, and the way you know you've held it correctly and done it correctly is there's no pain afterwards. I hope that's helpful.
Yep, here are a couple other questions that we've got. As a podiatrist, are you limited to parts of the body within the scope of practice in each state?
That's a very good question. Me personally, I'll tell you some of the stories. I don't recommend it. It's the same scope that you have as the podiatrist, period, with the laser. I know I've heard in Florida, actually California, where they're using lasers, therapy lasers, and not making a diagnosis and treating backs, necks. I don't recommend it. I don't judge it. I'm not in California, but you stay within your scope is what I'm saying. And if your scope's from the knee down, that's what you do. If your scope's from the Achilles down, or it's the foot and ankle, if anybody has any question to what their scope is, I actually have. If you're talking about who can use it and who can't use it, if you give me the state, I can look it up. I have a chart that I can send to you. But you want to follow your same scope. I don't know if you're talking about can you use it or can staff use it. That's a whole separate question. I don't know if I've answered your question correctly, but there's two questions. One is, what's the scope of practice? Well, you should know your scope of practice. If you don't, I can help you with it. Then there's who can use the laser. That's another question.
Oh, I think you're going to like this next question, David, just because it will ring true to all of the fabulous things about the laser. And we'll probably want to reference a little bit of what Dr. Barrett had previously discussed on one of our recent laser chats. The question is, I have a house call only practice in New York City, mostly elderly, diabetics, etc. Would this be suitable for this patient population, as well as transporting the REMI by car from patient to patient?
First of all, absolutely. I do have some foot care nurses that use it on house calls. House calls are great. I mean, it's only 4 pounds. It's mobile. It actually comes in a shockproof case, waterproof shockproof case. I have one podiatrist in Florida that puts it in her pocketbook. I don't recommend it, but she puts it. It's very transportable and easy. It's a plug in and go. And you can. I got to tell you another thing I've left out is arthritis is an amazing treatment with the REMI and class 4 lasers. So yes, if they have inflammation, arthritis, plantar fasciitis, Achilles tendonitis, neuroma pain, anything with inflammation, I could go on and on, bunion pain, anything that hurts. If it's pain and inflammation, the REMI is going to help you. A lot of people say, well, work on this condition. Well, you got to go back. Is there pain and inflammation? Inflammation is very important. If there is, yes, it will work. I hope that's helpful. So yeah, house calls I think are great. It's great. I mean, I've used the REMI in the NFL and the NBA, where it was a larger one, but we took it with us right to into the stadiums. So they're very portable. They're very portable. This one's the most portable. I've taken 40-pound lasers and moved around. In New York City, it's easy. The only time I had a problem in New York City many, many, many years ago after 9/11, you had, I don't think they do that anymore, but the security check was amazing. Yeah, I don't think you have that problem now today. And I used to wait an hour getting in. And it's funny when I just made this thought is they never checked my laser. I've taken this on a plane and they check me up and down and they never checked the laser. I'm just shocked. So I don't think there's any security issues at all. So that's yes is my answer.
Cool. Did you have any comments on regarding what we had discussed with Dr. Barrett previously about using the class 4 laser for neuropathy?
Yeah, it's no, Dr. Barrett put it out, and I've always known this. He's using it for neuropathy, and it's one part of a neuropathy program. Neuropathy is I mean, is it chemical neuropathy? Is it the diabetic neuropathy? I personally, you got to really be into neuropathy if you're going to take it serious. You got to have a team, endocrinologist, pain management, yeah, and maybe sometimes a psychiatrist. It's very good for the patient has some burning, tingling, difficulty sleeping. But if you're really going to build a neuropathy clinic, there's no borderline. It's on, and you're either in the game or out of the game. I personally don't want to see you build a neuropathy clinic until you learn how to treat pain. It's something you don't, for day one, you don't put on your sign, you're a neuropathy expert. As much time as you put into uh, the treatments, diagnosing, and the use of the REMI, the better you'll be. Now, another thing that a lot of people miss out on the REMI is that post-operatively, pain, swelling, inflammation. Dr. Barrett pointed out, Steve pointed out that after a couple of weeks, he'd have patients after he's done surgery, they got a little inflammation. He'd always put them on antibiotics, inflammation, maybe a superficial infection, and he'd use the Remy on them, and he's reduced almost to zero his use of antibiotics when he sees that little flare up. The Remy is great for physical therapy, trauma, inflammation. It's great for range of motion. I can teach how to use it for hallux limitus. A lot of people don't realize it can be an adjunct or a complete substitution for physical therapy, where you can keep it in your office. Um, when I train people afterwards, to me, the easy part is me convincing somebody, for lack of a better word, to buy the Remy. The hardest part is the hours that I will spend with you one-on-one, just like we're doing now, of how to use the Remy, when to use the Remy, how to diagnose it. Again, the Remy, pain management or class 4 lasers like the Remy, it's physiatry, or it's not physical therapy. You got to have the right diagnosis and an approach to it. And we go over that. There's about 4 or 5 basic things. I told you about the palpation before and afterward. That's how you know it's done. But we have other things, just with warts, and it takes a long time. It's not like one and done, the trainings. I hope that's
I was
helpful.
gonna circle back really quick, David. I apologize. I left out part of the question regarding the placement of the handpiece that you were going over earlier. Do you use the 15, 20, 25, or 30 when you're
I
doing?
like I like the 20. On the foot and ankle and the lower extremity, I use a 20. That increases the power density. That's important. When you change the spot size, you're increasing the power density. So you're making it stronger without changing the protocols. I don't think you should ever have to touch the protocols. There's 2 things you can do. You can press deeper, longer in a spot, shorten your strokes, because power density is time over area, and the peak power in there. You want to get the dosage. And the analogy I give is antibiotics. You can have the right antibiotic, but if you don't have the right dosage, you're not going to get rid of the infection. Same thing with the Remy. If you have the right power, okay, the right wavelengths, you got to get the right dosage over a certain period of time. And the way to judge that is the palpation before. You may not be sure. One thing about lasers, they're not used because you don't know what you don't have anything else to do. It's not this last ditch thing. It's, you know, the diagnosis, you understand the power density, and there's many videos that we've done in the past and on my training session that shows this. I hope that answers it. But the way you know you've got the right placement and the right area is to palpate it after you're treated for 2 or 3 minutes. I mean, it's not really that difficult. There's some cases that can be a little difficult. A lot of times when you treat it and you've gotten rid of the pain and they come back and they have pain in another area, then I had one case where I was treating a second MPJ pain on a patient, and he got a little better, and came back, and I realized he was walking on his forefoot because he had equinus. I didn't treat the equinus. I treated the nerves going to the area. So you can learn, there's layers of pain. You can learn and get a better diagnosis by just treating the area and realizing, well, I got rid of the capsulitis, but there may be some neuritis in the area. There may be some biomechanical equinus also. So there's a lot to lasers. You can be very good at a laser, but if you want to be an expert, you got to really get involved in this, and you got to really. I try to help you. I'm always willing to help anybody. Go over it and over and over it again. There is a little bit of learning curve. It's like a bunion. After you do so many and you understand the principles, and proper dissection, doesn't matter what kind of deformity you're treating, you understand it. But the most important thing I can tell tonight is palpate it before, palpate it during, and then repalpate it. I'm talking about this is the fascia, the trigger point areas, and that's how you know you've got the right dosage for the right amount of time in that target area. I hope that makes sense to you.
Okay. And then I know we want to get moving on to Dr. Melky's portion of the presentation tonight, but I've got one last question for you, David. It says, Dr. Zuckerman mentioned nurses using it on home patients. Does a
Yeah.
doctor not need to be present during treatment, or at least in the building, or not?
Well, it depends on the state, but generally speaking, the doctor, I mean, every state, I got a whole list of them, but most likely the doctor always has to be in the building. You have a foot care nurse has a license. Yeah, and for example, in New York, they can treat the feet. They can't do surgery, but they can use lasers in New York. Um, like for example, in New Jersey, the physician has to either use it or be there at all times. Is it enforced? I don't think it is really enforced. But the worst thing you want to do is see patients with your assistant and you're not even around. At the very minimum, I'll get very specific. You tell me the state, I'll look up and I'll tell you about it. But I can't see anybody doing a laser treatment, and not being in the building at the minimum.
All right, very good. Well, thank you, David. That was really, really helpful. And everyone, we are recording this webinar as well. So if there's anything that you need to, well, if you want to see again, or that you maybe missed the first time, we will be able to get you a recording of all of this information. Keep in mind also that at remylaser.com, there are various videos of David doing laser chat. And if you want to take some time to look at other elements of the laser, you can always reference that. But at this time, I'm going to move on to another major key point of success for Class 4 lasers in your practice, and that is utilizing marketing. And one of the best people that you can talk to or get advice from when it comes to Class 4 lasers and marketing in your practice is Dr. Chris Mielke. He is a podiatrist in the Milwaukee, Wisconsin area, and he currently is utilizing the Remy laser and not only getting fantastic patient results, but utilizing his marketing strategies to make patients aware, educate patients about how lasers work, why they are effective, and he's basically walking the walk and talking the talk when it comes to utilizing the technology, but then also creating a successful practice with that technology. So, Dr. Mielke, I'm not seeing your screen at the moment. If you want to share your screen, that would be super helpful, but we're ready for you whenever you're good to go.
So I'm hitting sharing here and it's not showing me the,
Oh,
you gotta switch over for me.
okay, let's see here.
I'm the presenter right now.
Okay, I will get that taken care of.
While you're doing that, I've never used the word photobiomodulation when selling laser packages to my patients. So it's a great word, but I don't think anybody needs to use that for selling the laser, prescribing the laser to patients. You see my screen okay?
Yes.
We can, yes, absolutely. Thank you.
Excellent. Good. So one of the things I love about the laser, first of all, David, thank you for that. I always learn something new when I hear you speak. I watch your laser chats. I'm always looking for that slight edge, just one more tool in the toolbox to share with my patients and get them the best outcomes possible. One of the things I love about the laser is how portable it is. When I first got mine, the first thing I did with it was treat a shoulder. No, it wasn't a patient. It was my girlfriend. And she had a really bad shoulder and arm problem. It was probably more neurological, some muscular as well. But she had 2 shots. She had all sorts of pain creams. She had seen physical therapists for quite some time, and she just couldn't get relief. So I was able to bring it to her home and just, transport it back and forth. And she said I just did 3 treatments on her this past weekend again. This was last year before the golf season or during the golf season. And she said it's the only thing that's really ever helped her. So it started to flare up a little bit again. And we did 3 treatments and we played a round of golf this afternoon. So thanks to the Remy laser, she can get out there and continue to play. So the portability of it is awesome. So what do we know about Class 4 lasers? I'm like David. I like to keep it simple, stupid, as he had mentioned. So, there's no mystery that we know that this technology is proven. I know some people on the call have a laser. I know some people on the call are looking into the laser. There's just no mystery that the laser works. So there's plenty of articles out there about that. But if you have any questions about that, obviously David is your resource for that. He's been in the laser world for many years. He's a trusted authority when it comes to lasers. And it was one of the big reasons why I decided to purchase this particular laser. Certainly the price point was a big factor as well. I'm not interested in spending $60,000 on a unit when I can get the same outcomes with his price point of $14,500. We all know that patients want non-invasive options, right? I mean, it's part of my brand is bringing as many non-invasive options to patients. It's really easy to administer. I mean, just that session right there that David did, you can see how easy it is. The handpiece is great. It's easier for myself or a staff member, and now pretty much 99% of the time, a staff member is doing it for me. Lasers are intriguing to the public. I always think both technology, innovation, and marketing, and lasers are intriguing. People like lasers, and you just bring up that word, and they perk up. So I'm always looking for as many intriguing innovations to bring to the practice that are going to get patients the best outcomes without having to cut on them. It's incredibly safe. I've never seen a side effect. As long as you're careful with skin conditions and things like that, you can use it on pretty much anything. The REMI is multifunctional, so we've used it on warts and pain. We've yet to use it on toenail fungus. We do have another laser for that, but we're in the process of switching over, or at least starting to use it on some of the patients, because I want to be able to use it to its fullest capacity. But I love the fact that it is multifunctional. You all know the investment is quite low compared to other lasers, and getting a positive return on investment as quickly as possible is something that we're all interested in. So the question is, we know all these things, and chances are most people on the call know all these things. And if you have to go to the top here and learn more about the technology, if you're still wondering whether the technology is proven, then of course David is your resource, or just go online and you can see how long class 4 lasers have been around. I had one 20 years ago, and it wasn't as accepted, and I used it for a while, and I saw some decent outcomes with it, but it just kind of fell by the wayside. And here we are 20 years later, and I'm back to using class 4 lasers. So what's the missing piece? Why is it that some people are still hesitant to bring this technology into the business? And here's what I really believe it comes down to. Can I, the podiatrist, confidently prescribe the technology to the patients I feel could benefit from it? So when I say can I actually get the words out of my mouth to tell them what I believe is going to work for them, knowing that they are going to have to pull out their credit card, checkbook, cash? It's the stumbling block to many people when it comes to cash services. We're so used to having third-party payers. And I can't believe, or I can't even tell you the number of podiatrists I've had conversations with about this. And many of them will admit to, I'm just not good at, I use the word prescribe because I truly believe that if you switch your mindset from selling to prescribing, you're going to be able to get patients the outcomes that they deserve. And if you don't prejudge them, many of them are going to say yes to what you're prescribing. So the numbers are quite staggering in terms of how many doctors just don't, they aren't good at prescribing cash services because they're afraid that the patient's going to say no, or how they're going to be perceived, or whatever the case may be. And I'm no salesman, but I certainly know how to prescribe the things that I believe are the best things for the patients. So what's the story you want to tell? And if in your mind the story is I need to pay for my lease, or I need to get my 14.5 return on investment, then it's not going to come across to the patient the right way. So the story for me, and you all have a story, and this is your differentiator, the story for me is it's part of our brand. We believe in non-invasive treatments. We believe in doing whatever we can to get the patient better without surgery. The other story is I really don't want to send people to physical therapy. I rarely send people to physical therapy. I probably take a contrarian approach to this because I know a lot of podiatrists do send to physical therapy. And I say, I want to keep the patient in the practice and do whatever I can for them to get them better. Number one is I believe I have the tools to do that. Number two is they're comfortable with me. They like me. They trust me. Going to another place can be a little scary. They're comfortable in my business. And number three is I want to generate the revenue for it. So I'm in business to also generate revenue, not just get patients better. So it's part of my story. It's part of my brand. And you all have a story. And it's not just I have a laser and I want to make money off of it. Of course, that's not the case. You want to get your patients better, and you also want to generate revenue for the business. And does the laser align with your brand? So again, we all have a brand, and some of us know it better than others, but we all have a brand, and thinking about how it fits into your brand, of course, is important. I also like getting paid before doing the work. We always get paid with third party after we do the work, right? We do a surgery, and then sometimes it's, if we're really lucky, 45 days, and if we're not, it's 90 to 120. But it's wonderful to prescribe something and have the patient walk to the front desk and actually pay for it before we even do the work. So we all know what happened the past 8 weeks and what we're still kind of in the midst of. Certainly cash is king, and being able to prescribe something that's going to get the patient the outcome and then have the revenue go right to the bottom line is something that I enjoy, and I'm sure all of you do as well. And I talked about this, keeping the money in the business, not sending to physical therapy. Now, are there times I send to physical therapy? Of course. I don't do a ton of surgery, so there's not the need to do that for post-operative cases, but yet I would still be using the laser on them if I did. And I mean, I can't remember the last time I sent someone to physical therapy, because fortunately we get the outcomes that we're looking for right in the practice. Here's a biggie when it comes to marketing. When you get a new tool, a new piece of technology, and David, I kind of joke about like a new widget, right? I mean, laser is another widget. An EPAT is a widget. A laser for toenail fungus is a widget. So the real question is, do you have influence with your list? And your list being your patients. My mentor in terms of marketing is Dan Kennedy, and he calls it a herd. So, he means that, in a compassionate way, but our list, the people that we brought into our business, and hopefully you kept them in the practice and they're not going out the back door. But how influential are you with your list? And can you send a message to them about the new technology without really selling, and just, give them information about it and content about it? That's really going to determine how quickly you can start to get patients in that will need the laser, and start to get, a little bit of return. But again, it's not about that. Like David talked about long-term. I love that. It's really about long-term with this. When I buy a piece of technology, I'm not thinking about, the next 3 months or even year. I'm thinking about the next 10 years. I mean, this thing's going to live in my business forever. And by the way, all this technology is free. You're just going to, have to get patients in the door, and they're going to pay for it for you. It's not something that, you're going to put off into the corner. Unless you're not, one to market it and really understand how beneficial it can be for your patients. And I've been in practices where, I've done consulting in podiatry practices and saw a large laser sitting over in the corner collecting dust. And the question was, what's that doing over there? And the answer was, well, we just haven't talked about it with the patients. And I have one podiatrist in particular who all of a sudden started talking about it and started to do laser treatments, didn't have the REMI, and then decided, this actually works. The more I talk about it with patients, the more they actually say yes to it. And then she decided to purchase the REMI and has it in another office. So you can go from not doing much of this to doing plenty of this. But having influence with your list is really important. You don't need to spend a dime on external marketing. This is not newspaper, radio, TV, all those things. It's not necessary, especially if you have a mature practice. Now, if you've only been in practice for a couple of years and you don't have a big list, maybe you might want to consider a little bit of that. But even so, you have a list, you have patients that have coming in the door, and you're going to continue to build that list. And then the more influential you are with it, the easier it's going to be to have discussions. And I call it planting seeds so that ultimately you get a harvest, sometimes quickly. Oftentimes it can take some time, as David mentioned, but you don't have to spend money on external marketing to be able to have patients in your practice say yes to your prescription for the laser, for pain, for warts, for toenail fungus, if you decide to use it for that. What we really want to do with this is build and tell stories. And that's why we talk about like momentum, getting that snowball flowing downhill. This goes with anything you're doing in your business. You know, the more you tell stories, and that's really how I sell laser packages to my patients. I tell them a story. I tell them the story of the patient who owns a bakery and has had pain in her ankle for 3 years. And I've done a few things for her, didn't get her better, did an MRI. There was no tear or anything bad going on. She just had pain and edema. And as David mentioned, pain and inflammation. That's how I sell the laser. You have pain and inflammation, and maybe we tried a couple things, maybe not, but this is the technology I believe in. So I tell the story of the bakery owner. I tell the story of the popcorn store owner. I tell the story of, you know, even my girlfriend, the shoulder, and the fact that she couldn't get better with other things, and the laser was the ticket for her. So the more stories we tell, the more patients buy. And if you do it with enthusiasm, you're ethical about it, and there's integrity behind it, that's what patients buy into. They're really buying you. They're not buying your widget. They're buying your experience and what you know works best. That's essentially what it is. It's not about brochures and, you know, posters and social media posts and all those things. I mean, those are important, and I believe it's part of putting extra tools in your toolbox. I call it, you know, putting more poles in the water. We're fishing. We want to have as many poles in the water as possible. And the number one thing to catch the best fish is building and telling stories. It works for just about anything you have in your business. So I believe in multimedia content. So we're not just doing one thing to bring patients in. Again, we're not just putting one fishing pole in the water and trying to get the big marlin or the big whale. That's not the case here. We're looking for multiple poles and different ways to bring patients into the practice, and patients that are in the practice already that are going to buy into what you have. So direct mail, of course. I mean, you have influence with your list. I'm constantly sending direct mail piece. Yep, letter, envelope, stamp, out the door it goes to my patients who know me, like me, and trust me. And here's a letter about this new piece of technology I have in the business. No, I'm not selling them, you know, like offers and things like that. I'm just letting them know what we have. We have this wonderful piece of technology. It does this, this, and this. Here's a story about it. If you're interested in more, schedule an appointment, we can talk about it. And that's all about planting seeds. So I just had a patient in the office yesterday. You know, we had that conversation 3 months ago, Dr. Milky, about that laser treatment. You gave me a cortisone shot. It helped for a couple of weeks. I really do want you to give me another cortisone shot today because I'd like some relief now, but I want to go ahead and schedule those laser treatments. That's what happens. You plant the seeds and then you water them with direct mail, with email, with all the different tools you have here to reach out to your patients. They walk in the door and they start selling themselves on the lasers. You don't have to sit there and, you know, try to explain photobiomodulation and the different things that you could be saying to them. I never use those terms. What does it do? It gets rid of pain and inflammation. I really don't go any further. I don't talk about dual wavelength. I don't talk about all the different bells and whistles that the laser has. I don't tell them it's 4 pounds. They don't care about any of that. What they care about is what it's going to do for them. What's the result? What's the outcome? What can I do after I have my laser treatments? That's what they want, right? It's not that they're looking for a nail. They're looking for, you know, like what the nail does for it. It can hang a picture, right? That's what the laser does for them. It gets them a result. Email, we have an email program we use. I highly recommend sending patients your emails. We send emails in my practice twice a week. I have a number of people who are using what I call the ultimate podiatric marketing machine. They're sending emails weekly, and I constantly get podiatrists sending me messages saying my patients come in and they love my emails. They love my emails. Guess what? It's way easier to get patients to say yes to cash services, or any services for that matter, when you're nurturing those relationships. You're building more influence with them. You are more of an authority. You are an expert in their eyes. That's what does it over trying to use big words and you know, different things you want to say to them to try to sell them. Sarah with 10 Toes Marketing has brochures and posters that are part of David's marketing package, which is wonderful. Again, innovation and technology, innovation, technology, and marketing. You really want to marry the two of them. So you marry the innovation with the marketing, and it's going to be a lot easier. But you got to think long term about this. This doesn't happen overnight. It's not like 5 patients are going to come to the door. Now you might build up a pent up demand, and you might have 5 patients that are ready to go with this. That would be awesome. But then it doesn't sit in the corner and it never gets used again. You got to think long term about this for this to really be effective. And then social media, I do believe in doing posts. It's inexpensive. It's actually free. There's a little bit of time involved to it, but consistency with all of these things is really the key. It's not being a one-trick pony. This is not just about like one social media post or one letter, or I'm going to send one letter to my doctor referrals, and all of a sudden there's going to be a flood of patients. It's just doing it over and over and over again. And David and Sarah with 10 Toes Marketing have things that you can be putting on your website, and certainly you want to do whatever you can to reach out to patients and let them know. I want to attract the patients to me that need this, rather than feeling like I have to go out there and try to find them. So the more of these things you do, the better it's going to be. I do believe in mass media marketing for specific things, but I don't believe that the pain laser, especially since we're limited to the foot and ankle. If I was doing the whole body, I'd be doing mass media. But because we are limited, I don't believe that it's technology for that type of thing. And the absolute #1 best marketing tool by far is your mouth, is you talking to patients about this. Your laser is not going to sell, and it's not going to get your patients outcomes by itself. It's not going to happen from a brochure or a poster or a social media post or your website or any of the things that I mentioned in there. It's going to be about you having conversations with your patients about technology that you believe works. If you believe it's the right thing for the patient and you have confidence behind it, and they really believe that you're not just trying to sell them something, you're going to get more of them to say yes. Does every one of them say yes? Absolutely not. But I just say it's not the right timing. It's not. But oftentimes they'll come back around, especially if they realize that there's not a better option, that this is better than trying surgery or going to surgery. And we do know that at times surgery is necessary. But for you to be successful with this, the words have to come out of your mouth. And it's just about doing it over and over and over again, and really believing in the fact that you're providing the patient with something that is non-invasive, is safe, and the success rate with it is quite high. And expectations are really important with patients. Let them know that nothing's 100%. It may not work. But I can tell you this, I have yet to have one patient ever ask for their money back, because I over deliver. And I think that's also really important. And David believes in that. If it's going to be 6 lasers in this particular package, and I believe they need 2 more, I'm going to give them 2 more without charging them extra. Over delivering is absolutely critical when it comes to selling the laser. And just the last thing I want to mention is Monday and Tuesday of this week, I sold $4,200 in cash services, and laser was a big part of that. And these were patients that I had planted seeds with a while back. These are patients that I've had influence with, that get my emails. That's what can happen for you if you do the right marketing to this. You learn the tools, that the different skills that you need with the laser, as David talked about. You continue to get continuing education on that, so that you can get that slight edge, get the patients better, and maybe use it on things that you weren't originally using it for, and you'll be able to do the same thing for your business. So with that, Sarah, thank you, David, for having me. I'm certainly willing to answer any marketing questions or questions at all about patients that might be good for this.
Thanks, Dr. Mielke. I haven't seen any questions come in so far, but I do want to invite everybody to ask any last minute questions. If you have anything regarding marketing and just anything that Dr. Mielke went over, but as we're waiting on some potential questions to come through, I'll kind of start, what are your thoughts, Dr. Milky, in terms of email marketing repetition? How often do you email your patients, and where do you think is a good balance?
Well, for me personally, we're doing it twice a week, but you don't just get to twice a week without, starting somewhere. And it was once a month when I first started, which by the way, isn't enough. I believe once a week is really the best way to do it. There's some people that believe that 3 times a week is the absolute best. It's not realistic to do that unless you're really spending a lot of time on marketing. I spend a fair amount of time on marketing, so I have a system in place. But if you can get to the point where you're sending emails to your patients at least once a week, that would be great. Email marketing is probably, outside of, patient referrals, and we get a lot from the web, and we still get some doctor referrals. But email marketing in the last couple of years has become way high on the list in terms of, patient retention, patient referrals, reactivations, things like that. So I'm a big believer in, it's just such an easy medium to use. So, if you can get to a point where you're sending at least a couple times a month, it's going to be better than nothing. But certainly if you can get to the point where you're sending a message at least once a week, you're going to really see a lot of traction with that.
Okay. One question I had, I'm curious to know, and this is kind of just a little bit more regarding how you've branded your practice as I don't know if you've branded it as a laser practice, and I guess that's kind of the root of my question. Do you brand a separate laser center for your practice, or is lasers just what you described earlier, more of just a widget in your bag of tricks?
It's a widget in the bag of tricks. Yeah, I don't have any branding for any of that. I don't necessarily believe in that as much unless someone's really going to, like David talked about neuropathy, and that's a perfect example. You're either all in on branding something or you're not. This whole thing about I'm going to be the heel pain center of excellence, I'm going to be the diabetic center of excellence. I don't, actually from a marketing perspective, unless you're really going to spend a lot of time on marketing and even some dollars on marketing and do it consistently over and over and over again, it doesn't make sense. I just want more volume. The more people that walk in my doors, the more opportunities I have to talk about all the widgets that I have in my practice. The more I send email messages and direct mail messages and things like that, the more opportunities I have to have conversations about the different innovations that I have in the business that's going to get patients better.
I think that's interesting. And the reason I think that that's interesting is because when I have discussions with practices regarding branding and becoming, or whether you pronounce it niche or niche, whatever your favorite tomato is, um, when we discuss that type of concept, a lot of practices feel that if they stick to something, that maybe they're too pigeonholed, that they want to stick to general podiatry and get all sorts of patients. And the reason I think what you're doing is, I guess, significant is because a lot of branding specialists will say you need to be the heel pain center, you need to be the bunion king, and focus on a condition when it might, and that is a strategy. It absolutely, that can work. But I don't believe that it necessarily needs to be the only strategy. And one of the things that I heard you say earlier is that your brand is more focused on the conservative treatment. And so it's not even necessarily about the specific condition that you need to wrap, that you need to shape the brand around, but more about the type of treatment that you provide. And so there's always different angles of how you can still be a niche practice without quote unquote pigeonholing yourself into a specific type of condition, if that makes sense.
Yeah, absolutely, 100%. Yeah, well, the question I would have for anybody that is interested in that type of thing or thinks that might be the right direction to go is how many heel pain centers of excellence, how many diabetic centers of excellence, how many neuropathy centers of excellence, how many ingrown centers of excellence are there in the podiatry industry? I'm not sure I know of any, and I've been up and down the country, coast to coast, top to bottom, side to side.
Right.
It's not, again, can it work? It can work. The amount of time and dedication to it also from a dollar standpoint, is not something that most people are willing to do. That's really what it takes to, I mean, branding is a big deal. Like Coca-Cola, McDonald's, Apple, that's branding. We don't do that type of branding. I just believe in, I do want certain types of patients in my practice. I don't want to do a lot of like, what we would call at risk or routine foot care, whatever words you want to put to that. I want to see musculoskeletal conditions. And that's pretty much what I see because that's what I put as part of my brand. And within that, I can do lasers, I can do EPAT, I can do toenail fungus lasers, I can do regenerative injections, I can do the things that I really love to do without pigeonholing myself into this center of excellence.
Right. And I think that's great that you discuss the type of patients you want to see because I think that's where a lot of physicians are struggling in that they do marketing that is just casting out a net and seeing what catches. But if you can determine and really ask yourself, what type of patient do I want to see? Do I want to see senior citizens on Medicare? If you do, that's fine. Then start creating a marketing plan that targets that audience. But if you want to see people in their late 20s to early 40s in sports medicine, that's a very different marketing message and a very different channel of communication that you're going to have to take. And so then you can determine what your communication strategy and where your marketing dollars are going to be spent. So when you determine those sorts of goals, you really are you're shaping your brand based on the types of patients you want to see.
Yeah, no question about it. You know what's wonderful about being an independent podiatrist and not working for a healthcare system? I get to choose, and all of you, if you're in the same position I am, and the chances are you're not working for a healthcare system, you get to choose the game you want to play. And the game I want to play is I want to see musculoskeletal conditions. I don't want to see the other things. Now, do we have it in the practice? We have it in the practice. Am I going to turn them away? Absolutely not. But I don't want to build my schedule with those kinds of patients. I don't enjoy doing it. It's not fulfilling to me, and there's no revenue involved with it. So I get to choose the type of practice I want, and all you do as well. So it doesn't happen overnight. It didn't happen for me overnight. Many years ago, I was doing more routine things and things that I wasn't necessarily in love with. But I decided to message and put content out to my patients for the things that I wanted to see and the patients that I wanted to see. So, patients now do know what my brand is and what I'm looking for, and like refers like. So the patients that have these conditions are going to refer the patients that also have those conditions. If you have a bunch of patients in the practice that are toenails and calluses and things like that, again, I have nothing against that. I've done plenty of that. I still do some of that. You're going to get patients that are going to refer those things to you. So I think the most important thing is just think long-term with it. And it's about consistency. Like, you can make this laser thing so effective and so profitable if you just think long-term with it. It all works. It absolutely all works. It just can take some time. And if you just commit to that, you're going to definitely reap a very big harvest.
Absolutely. So I'm done with my discussion and the questions that I had. I could go on for probably 3 hours with you back and forth on a lot of these things, but I'll actually let our participants ask questions since that's what we're here for. So one question that did just come in: how do you change your practice type after 25 years?
Well, yeah, like one baby step at a time. Like, number one, what do you want? Like, what do you want your practice to be? Don't think of it in terms of radical. Take your time. I mean, you really have to decide what you want. Like, if you're talking about going from more of a, at-risk foot care routine practice to musculoskeletal, or, like more technology, EPAT, laser, things like that, you do it while you're doing other things. You kind of straddle. I mean, just going from like third-party payers to all cash is a radical switch. You just do it a little bit at a time. And that's what you do in this case. Like, really know what you're looking for. And then it comes down to the marketing, the messaging. Like, you have to have the content and the messages in all the different mediums that I showed you there: email, direct mail, social, website, all those things, that kind of lean in that direction so that your patients know who you are, what you're looking for. It really, really doesn't happen overnight. It can take some time to do that, but so what? I mean, if that's what you're looking to do and you still got a number of years to do it, then start now and just take baby steps and, work towards that and put a vision out there for, like, in 2 to 3 years, my practice is going to be 50% of what you want and maybe 50% of what you're doing. And then in 5 years, it's going to be, 80% of what you want and 20% maybe of, the things that you don't want to do as much, or 100%. I mean, totally depends on what your vision is and what you're looking to accomplish in your business. It's very doable. It just doesn't happen overnight, and it doesn't typically happen with just this radical switch.
Absolutely. So, and here's a question regarding the cash aspect of the practice and pricing and such. So this is, so do you offer a package or just charge per treatment? And what do you recommend for fees?
Well, number one, as David mentioned, this laser doesn't work with just one treatment. Now, could it feel better when they walk out the door? Sure, that's possible. I've never done a one treatment approach. It's always a package. I always do at least 6. And I'm not going to talk about, like, my fees or anything like that, because I don't think that's the right thing for this space. You got to decide what fees are right for you. But it's always a package. I know what it takes for the patient to get better. And I tell them, in 1 or 2 treatments, you might not feel that much different, but 3, 4, 5, it might start to feel great. So I want them to know that, it's like going to the physical therapist. They know what that looks like. They have to go multiple times, and typically they're spending a decent amount of out-of-pocket copay and coinsurance and things like that. I don't really get into talking a lot about fees with patients, other than saying, these are the 6 treatments, this is the plan, and this is the fee structure for that particular plan. And again, most will accept, some won't, and the ones that won't, some will come back.
Okay. And another question that has come in, and this is regarding the treatments in general. For plantar fasciitis, how many treatments do you recommend usually?
6 to 10, and it depends on the longevity. If they've had the problem for 6 months, it can be a little bit different. And I would say in that case, be suspicious of plantar fasciosis. It's probably not going to work for that. I've tested it on that. When I see a diagnostic ultrasound that has a fair amount of thickness, I definitely get very suspicious for plantar fasciosis, and I'm doing other things for that. So if I really believe it's more acute, it's going to be 6 to 8 treatments for that. But honestly, I can't say that I've done, like, most of my stuff has been more dorsal aspect of the foot, ankles, things like that. I use Shockwave for plantar fasciitis. That doesn't get better with some of the more conventional things that we do. But for plantar fasciitis, the ones that I've had success with, it's typically been between 6 and 10 treatments.
Okay, fantastic. Those are all the questions that have come in from our participants tonight. So I think we are in a position where we can wrap everything up. I know I'm appreciative of everything that was presented today, and I'm sure that everybody online is. Dr. Milky, Dr. Zuckerman, did you guys have any final thoughts?
Yeah, photobiomodulation. No, this was, I really enjoyed the discussion between Sarah and Chris tonight. The more discussion, the more answers. I just hope this was as helpful to me as it was. I hope the group that came on tonight, and I look forward to meeting more of the group.
Yeah, thanks so much. I just really appreciate the 2 of you allowing me to come on, and for everybody who was at home listening after hopefully a productive day at the office, and hopefully things are getting busier for everyone, and just taking the time to do this. If you don't have a Remy, talk to David. I mean, he is an authority on these things. He champions your success, which is very rare. Companies often sell you something and then you don't hear from them again. He's there with you, literally side by side on the same side of the table as you. He's not interested in making money. He's interested in your success and for you to make money and for you to get your patients better. So thank you guys so much.
Absolutely. And I'm sorry, I am going to answer one last question that just came in, just because it's regarding marketing and the 10 toes portion of David's package. So everyone is aware, David's laser package does come with a turnkey marketing toolkit. And the materials that come from 10 Toes Marketing are more of an internal marketing tool source. So I provide customized in-office brochures, in-office posters, and then you can also choose from postcards and handouts. There are educational videos that you can place in the waiting room for your patients to see beforehand. You can also place those videos on tablets or laptop screens in the exam rooms beforehand, which sometimes is a great tool for just education and cross promotion. Say somebody's not in for a laser treatment, whether it be for pain or for fungus, but they're in for something else. As they wait for you in the exam room, you can cross educate them with these tools. And then Dr. Milky has joined the team marketing wise to help with the email marketing aspect of David's program. So just to kind of give a little bit more clarity on the turnkey marketing toolkit that is provided with the Remy laser. And that's one of the things that I think is very valuable that David provides, because he is so passionate about ensuring that your practice receives ROI as quickly as possible. You are potentially likely to receive ROI with a lot of different lasers, but we want to make some revenue fast. And David's priced the laser already in such a competitive way that's going to make that much more possible. But then he puts a final stamp on it with the marketing tools that he provides. And that is a big point of differentiation with going with the Remy laser. So I am very excited to work with all of the practices that David works with the laser. So I hope that provides a little bit of clarity, though, in terms of how that is included.